Hey, Scobee Challengers, how's it going? My name's Dr. Mueller, and my son's actually Brett Mueller in Mrs. Mick's class. And it's an honor and a privilege for me to be able to come to you guys today virtually during this career day to kind of go through a little bit about what I do as an ophthalmologist and as an eye surgeon. So we're going to kind of go through a few little talking points today. First, I'm going to talk to you about what it takes to become an ophthalmologist. And then I'm going to go through a little bit of eye anatomy with you so that way you guys can kind of understand the three different diseases that I'm going to kind of touch on, which are going to be cataracts, refractive error, which are farsightedness, nearsightedness, and astigmatism, and hopefully I can kind of clarify what those terms mean and how I kind of as an eye surgeon approach those issues and fix them. And then what we're going to do is I'm going to take you to my office. I'm going to show you around. One cool thing about ophthalmology is we get to play with a lot of cool lasers, and I'm going to show you all of those kind of cool toys from there. And then we'll conclude the talk, and I'll give you guys my email and everything, so that way if you guys have any questions, feel free to reach out to me anytime. But let's get started. So first, I am an ophthalmologist. So what is an ophthalmologist? It's basically is that I'm an eye surgeon. For me to become an ophthalmologist, I had to go to college, and then I had to do 4 years of medical school. I actually did 3 years of graduate school on top of that, so I have a PhD as well as not only going to medical school. Then you have to do 4 years of residency, so more training on top of that. And then after residency, you got to do another potentially plus or minus if you want to. I did, but you don't have to. You can do a 1 to 2 year fellowship on top of that. So one thing about being an ophthalmologist, you gotta like going to school a lot, which I do, fortunately. I've been in school for a very long time, but these are the kind of few things you got to do to become an ophthalmologist. I thought, initially what I could do is just kind of go through a little bit of eye anatomy with you guys, just so you guys can understand a little bit of the disease processes that we're going to kind of talk about. So this is an eye, what a normal eye looks like. You see that this black thing here, that's called the pupil. That's kind of like the hole of the eye where light gets in. That's how we're able to see. This blue part is called the iris, okay? And this white part's called the sclera. All right. Now, if we look, this is an anatomical model and cross section. So we're looking, through like, the eyeball in this direction here. Again, this is the front surface. This is the back surface. And I kind of think of the eye in three different compartments. There's the front of the eye. This is the cornea. Again, sitting behind the cornea is the color part of the eye or the iris. Then sitting behind the iris is the lens. The lens is like the focusing structure in the eye that focuses light to the back part of the eye or the retina. And then the retina turns all these electrical signals, turns them into electrical impulses, sends them to the optic nerve, which sends all that information to the brain, and that's how we're able to see. It's a pretty incredible structure. So let's kind of go through a few of eye conditions, okay? So the most common eye condition that I kind of help people with and what I kind of specialize in is cataract surgery. I also do a bunch of refractive surgery as well. But cataract surgery, let's talk about that initially. Very common condition that we see here. And it's basically when the lens, which is shown right here, is not clear anymore, okay? So then what we got to do is we got to remove this lens. There's no medicines that we can take. It's that to make it go away. It's almost like you're inside your house looking outside through a window, but instead of the window being crystal clear, it's got some dirt, it's got some mud on it. So we got to replace the window. A picture here, this is a picture of a cataract eye. So, in this gentleman here, the left eye has a clear eye, but in this right eye, it is a cataract. So we got to remove the cataract. This is a picture of me operating. I do a lot of surgical mission trips. I go down to Mexico a lot, Guatemala, these third world countries to remove cataracts. These people are blinded by cataracts, especially, they're not as fortunate as we are here in the United States to get access to medical care. So I kind of volunteer my time and go down there and remove these kind of very dense cataracts that you're seeing in this picture here. So that's kind of like what a cataract is. Now let's talk about refractive error. So what is refractive error? It's like when you need glasses, contacts, or you could have a surgical procedure done to help, like LASIK, to help fix that. So in order for you to be able to see clearly without glasses, light has to focus into your eye, and then that lens focuses it to the back part of your eye or the retina. And it has to be perfectly focused into the retina. It can't be in front of it, can't be behind it, it has to be focused right on the retina in order for you to be able to see clearly. Now, in individuals that need glasses, I'm going to kind of helpfully clarify these terms. What does farsighted mean? What does nearsighted mean? What does astigmatism mean? All these different types of terms which can be corrected with glasses. They can be corrected with contacts, but also too they can be corrected with refractive surgery, which is what I specialize in. So I like helping people get out of glasses, get out of contacts. So I help fix that. So let's go with nearsighted first. So with nearsighted people, when light focuses into the eye, it focuses in front of the retina. Doesn't focus on the retina or behind the retina, focus in front. That's why people who are nearsighted, so that nearsighted means that you can see up close but you can't see far away. They need a negative glasses prescription. Those people who have negative glasses, contacts, that negative prescription helps push that light back to the back part of the retina, and that's how you're able to see. Far-sighted individuals, it's the opposite. So far-sighted, what does that mean? It means you can see far. And that's true for most people, but pretty much what that means is instead of light being focused onto your retina, it focuses behind your retina. Now, typically when you're young, your lens can kind of help bring that light back to the retina and help you to be able to see. But as you get older, that lens begins to stiffen. That's when you have to like push things out further and further and further in order to be able to see, or throw on some reading glasses, or you need a bifocal or something like that to help you. But that's essentially what farsightedness means, is that the light in the eye focuses behind the retina, and which also can be fixed with LASIK or other different refractive surgeries that I perform. And then there's astigmatism. Gosh, what is astigmatism? You know, it pretty much means that your eye is shaped like a football instead of being shaped like a basketball. So when light kind of goes into the eye, it doesn't get focused at one particular point, but multiple, usually two different focal points of light. So light can be focused here and it can be focused here, and that creates a blurring of the image. So again, can be fixed with glasses, can be fixed with contacts, or permanently fixed with refractive surgery, where we can create a more basketball shape of your eye instead of that football shape that it has. And then the last, condition that I treat is called glaucoma. Glaucoma, again, this is a picture of that eye that we were kind of talking about. Glaucoma is when the pressure in your eye is increased. So you may have heard people have high blood pressure. You might, maybe you guys have some parents or grandparents that have to take high blood pressure medication. Well, there's also high pressure that can happen inside the eye. And so what we have to do is we have to reduce that pressure, because if we don't, what can happen is this is the optic nerve. So the optic nerve here, again, that's the cable that connects the eye to the brain. This is a picture of it looking at it, front-wise, so or anterior to posterior. And this right here, you can see this kind of pinkish is a normal looking optic nerve. So that's a normal amount of nerve tissue from the eye that is going into that optic nerve, and all those signals are being transmitted to the brain. What happens with glaucoma is you get a degeneration of that optic nerve tissue. Look how thin that is. Look, you don't see that nice pink healthy tissue. So when the pressure's high, it can cause a diminish of that optic nerve tissue. So we got to protect that, and the way that we do that is we decrease pressure. There's different surgical procedures and stuff that we can do to help fix that. And we'll go through some of that stuff. Again, I'm going to come take you through my office right now, but here's my office at 9725 Data Point Road. So why don't you guys come on with me, and I'm going to take you through my office, okay? Hey, Scobee Challengers, how you doing? I'm Dr. Mueller. My son's Brett Mueller in Mrs. Mick's class right now. I thought I'd kind of show you around. Again, I'm an ophthalmologist. I wanted to show you around my office here. I work here in San Antonio at Parkhurst New Vision off of Worsbach and Data Point Road. We do all sorts of things here: cataract surgery, refractive surgery, LASIK surgery, glaucoma. We also do some oculoplastics as well. But why don't you guys come on in? I'm going to show you all about my office and everything like that we have going on. So why don't you follow me? So everybody, as an ophthalmologist, I perform surgery on people's eyes, where I help people to get out of glasses and contacts, predominantly refractive surgery. You may have heard different procedures like LASIK, PRK is another procedure that I do. And these are the two lasers that I use to be able to help people, to fix people's vision. So this right here is the state-of-the-art, one of the state-of-the-art lasers that we use. It's called the VisionMax. You know, in LASIK, what we want to do is kind of help change the shape of the cornea to help people get out of the glasses. And this is one of the lasers that helps us do that. And then why don't you guys come over here? This is another laser that we kind of utilize in order to be able to help, you know, fix people's eyes so they don't have to worry about glasses or contacts. So this is our LASIK suite that we have over here in San Antonio. So we're now going to take a trip and a tour through the rest of the office here, and then we're going to go into the operating room where I do different other procedures like cataract surgery, glaucoma, different glaucoma procedures as well. So why don't you guys come with me? So this is where our patients come in. This is the pre-op area where they come in before the surgeries. So we kind of get them all ready. These are our wonderful nurses here that kind of help out with that. So we get them all nicely dilated. We get the IV started. And they walk in here into the operating room, which I'll show you guys in a little bit. And then this is the post-op area. So after they've had the surgery, they come here to kind of recover. And then once they recover, then we, let them go and let them go home. One of the things that I also specialize in, this is another laser that we do. One cool thing about ophthalmology is that we get to play with a lot of different types of lasers. So this is laser number 3. One of the things that I kind of specialize in is something that's called laser cataract surgery. So what we do is we utilize a laser that helps us to soften up that cataract. It makes it a lot easier and safer for us to be able to remove from the eye. A lot different than what we used to do way back when. And then also it helps to get people out of glasses, fix astigmatism and stuff. So a lot of patients that come in, even after cataract surgery, we can get them to where they're not even having to wear glasses, not even at distance, intermediate, and up close. So it's amazing technology here. So this is the other laser that we utilize. And so we'll do the laser procedure, and then we'll then jump it into the OR. So the laser procedure takes about 90 seconds to do. And then here is our operating microscope. So this is the microscope that we kind of utilize. It helps to illuminate the eye so that we can then visualize and know what we're doing. We operate on a 3D system, so I don't know if you guys have ever been to like a 3D movie or whatever, but we do the same thing here where the 3D image is projected onto the screen, and that's how I'm able to see what it is that I'm doing during cataract surgery. It's a pretty incredible, nice technology. This machine here, in order to do cataract surgery, sometimes these cataracts can be kind of hard. This is called a phaco machine. It uses ultrasound energy to kind of break up the cataract into like a million different pieces, and then we remove that. So this is the instrument that we utilize to be able to do that too. So, all right, and then why don't you guys come with me? I'll show you an exam room. Here. So this is a typical exam room that you would see in an eye doctor's office. So when you're talking about eye doctors, there's two different types of eye doctors. There's optometrists, and then there's ophthalmologists. Optometrists are the ones that kind of, they're the ones that help with glasses and contacts and do a lot of the primary eye care that you would see around. They're the ones that do the different dilation exams and stuff. And then me being a board-certified fellowship-trained ophthalmologist, what I focus on is really the surgical aspect of the eye care. And whether that be LASIK, cataract surgery, glaucoma, that is what I focus on. And so here, this is a typical room that you would see in an eye doctor's office, which patients normally they'll sit here. And then we can then, check their vision. Some of you guys have probably had your visions checked where, we'll put up different letters and stuff onto the screen here. we try to see, okay, well, what's better, one or two? What we utilize is a machine called a phoropter, okay? And many of you are probably familiar with this equipment right here. But a phoropter, it looks like a big, pair of glasses, but they're not glasses. They have a different bunch of lenses and stuff inside, and this is how we can figure out what somebody's prescription is or what their glasses prescription is. And what an optometrist would utilize this for is to kind of say, okay, well, what kind of glasses do you need, or what kind of contacts do you want to wear? But what we utilize it for is what's your prescription in order of us, so that we can fix it in order to be able to do a LASIK procedure on you. We also have a device, and you may have seen this before or not, what's called a slit lamp. So a slit lamp is basically what we kind of utilize to help view and visualize the eye. So a slit lamp exam, pretty much illuminates the eye 10 times bigger than what it really is. And so this can kind of help us to be able to see and visualize, in patients where, the light kind of turns on here. Get this light to turn on. Yeah, there we go. Yep. So we can kind of see what is going on in patients' eyes. We can make the diagnosis of different medical problems or issues that they might have. The other thing that I kind of wanted to talk to you guys about is the anatomy of the eye. I know you guys have, excellent science teachers and stuff like that too, and you guys are learning about all this stuff, but the eye, is a very awesome, very unique structure. And the way that I kind of think about the eye, I kind of simplify things. I like to make things simple, is I divide it up into 3 different compartments. So there's the front surface of the eye, that's the clear part. Then there's the middle part of the eye, that's like behind the color part of the eye. And then there's the back part of the eye. Okay, so the front part that's the clear part of the cornea. Okay, this is like if we're going to do a LASIK procedure, this is where we're going to be focusing our treatment options, is right here onto the cornea. Then there's the color part of the eye, or the iris. Okay, so some people have blue irises, some people have brown irises, but this is the color part of the eye. And then sitting behind the iris is where the natural lens is. So, when you're born, this lens is crystal clear. But as you begin to age, this is where cataracts form. A lot of people think of cataracts, this growth or a membrane that's on the front surface of the eye, but it's not. It's actually inside the eye. So when we do cataract surgery, we have to go inside the eye to remove this lens. And then we're able to remove that and then put in a crystal clear lens, and it really helps people to be able to see. And really what we're trying to do is just make this really good, crisp image so that when light gets focused onto the back part of the eye, or the retina. So the retina is like a film on a camera that takes all those light signals, and then what it does is it takes light signals and turns them into electrical impulses. And so these electrical impulses get sent to the optic nerve, and the optic nerve is what connects the eye to the brain, and that's how we're able to see. So pretty much one of God's greatest organs right here is the eye and all that it's able to do. And I'm very privileged to be able to, on a daily basis, be able to help people to be able to see at their fullest, to be able to fix their eyes, to help them be able to see like they've never seen before. So that's what I am able to do as an ophthalmologist. So if you guys have any questions or anything like that for me, I'd be happy to, answer any questions like that. I'll send you my email and stuff like that. But I hope you guys learned something today. Thank you very much.
All right, guys. Well, welcome back. I hope you guys have had as much fun learning about all these different cool eye stuff as I had talking, through it with all you guys today. I had an immense amount of fun and pleasure talking about kind of like what I do on a daily basis. But just, in conclusion, let's just kind of go through the high points. So, to be an ophthalmologist, you need to like going to school, definitely. It takes a lot of school, takes a lot of training. So you need to really like going to school. Secondly, I think it's a must. You saw the cool little lasers that we have to use, so definitely you need to like playing with lasers if you want to be an ophthalmologist. Another thing, you have to be able to want to help people. You want to be able to help people to be able to see clearer than they've ever seen before. That's my objective every day, and that's what we kind of get to do as an ophthalmologist. And then lastly, and this goes with, being a surgeon of any type, you just really have to like being able to work with your hands. So I hope you guys learned a lot. I know we went through a lot of material, sometimes twice, going over the different anatomy of the eye, the different conditions and stuff that we have going on. But if you have any questions, please feel free to reach out to me anytime. This is my email address. Be happy to answer any questions that you have. But it's been a lot of fun. You guys take care. Thank you very much. Bye.